السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of PROMETRIC Test Question. This is lecture number 7 in leadership and number 37 in Ghaith review. Today we are going to discuss 5 questions from question number 202 up to question number 206. معكم محمد اسماعيل يحيى. نبدأ مباشرة. Question number 202. The nursing assistant with 20 years of experience approaches a recently graduated nurse who recently passed the licensing examination. The nursing assistant states, "The only difference between you and me is the size of our paychecks. Which of the following is the most appropriate response for the newly graduated nurse?" The options are: number A, assert a hierarchical position. Number B, emphasize the additional education received. Number C, explain the legal difference in the scope of the practice. Number D, focus on the need to work together for quality client care. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number D. Focus on the need to work together for quality client care. ليه اخترنا الخيار رقم D؟ نشوف rational. Team building involves recognizing that each person has specific strengths and personal skills that can be used to provide quality client care. And it is better to recognize each other's contributions than to confront. Therefore, the most appropriate response for the newly graduated nurse is to emphasize the common goal of working toward safe, quality client care. So, the correct option is option number D. Focus on the need to work together for quality client care. Question number 203. Nurse manager first days in new hospital will, the options are number A, introduce plan and strategy to top manager in hospital. Number B, introduce himself to staff. Number C, observation for 3 months before begin work. Number D, review previous plans and strategies. وقف الفيديو هنا واختار الخيار شوف صحيح. The correct option is option number B. Introduce himself to staff. ليه اخترنا الخيار رقم B؟ نشوف rational. It is important for the nurse manager to introduce himself to the staff because it shows his ability to meet new people confidently, and introducing yourself makes others feel more comfortable and allows you to make a good first impression. So the correct option is option number B. Introduce himself to staff. Question number 204. After accessing patients' medical records, which behavior by the nurse show patient confidentiality has been breached? The options are number A, reviews patient medical record. Number B, read patient care plan. Number C, disclosing patient information. Number D, asking family to share information about patient pre-hospitalization behavior. وقف الفيديو هنا واختار الخيار اللي تشوف صحيح. The correct option is option number C. Disclosing patient information. اللي اخترنا الخيار رقم C نشوف rational. A breach is defined as an impermissible use or disclose health information. Release of information without patient authorization violates the patient's right to privacy. So, the correct option is option number C, which is disclosing patient information. The other options are acceptable nursing practice. Question number 230. During the assessment phase of a preoperative interview, the patient reports feeling nervous. The patient conveys to the nurse that a parent died in surgery due to malignant hyperthermia. To whom would this information be most important? The options are number A, PACU nurse, post anesthesia care unit. Number B, scrub nurse. Number C, anesthesia team. Number D, child nurse. وقف الفيديو هنا واختار الخيار اللي تشوفه الصحيح. The correct option is option number C, anesthesia team. ليه اخترنا الخيار الخمسي؟ نشوف rational. Malignant hyperthermia is an autosomal dominant disorder characterized by hyperthermia with rigidity of skeletal muscles that can result in death. It may occur if an affected individual is exposed to certain general anesthetic agent. Therefore, this information is most important to anesthesia team. To prevent malignant hyperthermia, it is important for the nurse to obtain a careful family history. The patient known or suspected to be at risk for malignant hyperthermia can be anesthetized with minimal risk if appropriate precautions are taken. So, the correct option is option number C, anesthesia team. Question number 206. A child nurse was noted poor staffing schedule in one of the shifts. The schedule caused problems among staff members in the unit. To whom the child nurse should bring the problem to? The options are number A, supervisor. Number B, chief nurse. Number C, child nurse. Number D, grievance committee. وقف الفيديو هنا واختار الخيارات بتشوفها. The correct option is option number A, supervisor. ليه اخترنا الخيار رقم A؟ نشوف rational. The complaint must follow organizational structure from bottom to top. Based on the organizational structure of the nursing management, the child nurse submits the complaint to the nursing supervisor, and the nursing supervisor submits the complaint to directors of nursing, and directors of nursing submit the complaint to the CNO or CNE, Chief Nursing Officer or Chief Nursing Executive. So the correct option is option number A, supervisor. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.